Good afternoon, everyone. Today we'll focus on a condition that sits at the intersection of neurology and psychology, concussions. Often dismissed as just a bump on the head, concussions are in fact mild traumatic brain injuries that can have profound effects on memory, mood, and mental health. We'll examine what concussions are, their comorbidities, and especially their connections to anxiety disorders. What is a concussion? A concussion occurs when the brain is jolted inside the skull, typically by a blow to the head or body. Importantly, a concussion doesn't always cause visible brain damage. Most CT or MRI scans come back normal. Instead, the problem lies in how brain cells function. After a concussion, neurons may fire abnormally, blood flow to the brain changes, and the brain's metabolism goes into overdrive. This explains why symptoms are so broad: physical, headaches, dizziness, blurred vision; cognitive, memory lapses, slowed thinking; emotional, irritability, sadness or anxiety; sleep-related, insomnia or excessive drowsiness. You might notice this isn't just a neurological condition. Psychological effects are built into the symptom profile. 2. Comorbid conditions. Concussions rarely occur in isolation. They are often accompanied by other problems: post-concussion syndrome, PCS, lingering symptoms lasting weeks or even months, including cognitive fog, light sensitivity, and headaches. Chronic headaches, migraines, or tension headaches are common after injury. Mood disorders. Many individuals develop depression, especially if symptoms persist. Sleep disturbances. Disrupted sleep cycles make recovery harder. Neurodegenerative risk. Repeated concussions increase the likelihood of chronic traumatic encephalopathy, or CTE, a condition seen in retired athletes and military veterans. Think about this. A college football player with repeated concussions might not only have trouble remembering plays, but may also struggle with mood swings, chronic headaches, and long-term cognitive decline. 3. Concussions and anxiety disorders. Now, let's look more closely at the psychological dimension, especially anxiety. Are concussions connected to anxiety disorders? The answer is yes, closely. PTSD-like symptoms. Many concussions occur in traumatic contexts: car crashes, assaults, combat zones. The brain injury combines with emotional trauma, leading to flashbacks, intrusive thoughts, and hypervigilance. Generalized anxiety disorder, GAD. The uncertainty of recovery often fuels chronic worry. Patients ruminate. Will my memory ever return? Will these headaches stop? Panic disorder. Concussion symptoms like dizziness or rapid heart rate can trigger panic attacks. Imagine feeling lightheaded in a grocery store. You might think, "Am I about to pass out?" leading to spirals of fear. Social anxiety disorder. For some, the embarrassment of forgetting words mid-sentence or appearing off socially can trigger social anxiety. Overlap with PTSD. In veterans, blast injuries often lead to both concussion and PTSD. The two conditions can be hard to disentangle. Cognitive fog from a concussion looks very similar to the concentration problems of PTSD. So while not everyone who suffers a concussion develops an anxiety disorder, the risk is significantly elevated. IV. Clinical implications. From a treatment perspective, concussions require a multidisciplinary approach. Neurologists, psychologists, and psychiatrists often need to work together. Diagnosis. Doctors must separate neurological effects of the injury from psychological sequelae. Treatment: rest and gradual return to activity. Cognitive behavioral therapy, CBT, for anxiety or depression. Medication when needed for sleep, headaches, or mood. Prognosis: most recover within weeks, but comorbid anxiety or depression can prolong recovery, making early intervention critical. V. Special populations athletes. High risk for repetitive concussions. Think of professional football players who later show severe depression and anxiety. Military veterans. Blast concussions are frequently tied to PTSD, creating complex recovery challenges. Adolescents. Their brains are still developing, making recovery longer and psychological comorbidities more likely. Conclusion. So, to bring it all together, concussions are mild traumatic brain injuries that ripple far beyond headaches or dizziness. They are commonly comorbid with depression, sleep disturbances, and chronic headaches, and they are strongly linked to anxiety disorders such as GAD, panic disorder, and PTSD. This reminds us of an essential truth in psychology. The mind and the brain are inseparable. A blow to the head affects not only neurons, but also emotions, relationships, and identity. When we treat concussion patients, we're not just healing brains, we're helping people rebuild their sense of self and security.